Well, November is Diabetes Month, and if you have it actually, educating yourself will save your life, and it can also save your vision. Dr. Joe Myers is a medical optometrist with Nationwide Vision Centers, and he's here to explain how important those eye exams are. And you know, Dr. Myers, we talk about it all the time, but you've actually seen patients who were diabetic and didn't even know they were diabetic all through an eye exam?
Yeah, that's kind of the amazing part, and this being Diabetic Awareness Month is just a more reason to get in and have the eyes checked. We have patients who come in from all different age groups, all different types of diabetes, and they're always the ones that amaze me, including even last week. My staff and I even shared a couple of patients that completely healthy, completely normal, vision fine, hadn't been checked in 5 to 10 years. The parents or the children were a little concerned about their father who brought him in. He may have been in his early 60s. And sure enough, he had definitive changes in the back part of his eye with problems, but his vision was fine. He had no complaints. And it's all because we measured his blood sugar in the office. It was in the 300 or 400 range, which is not normal. And all of those changes can be seen because of the very small, intricate blood vessels in the back part of the eye. That's not to say that there's not problems going on elsewhere. Right. It's that we can pick up even those early changes with the vision.
So there are those moments where people are fine and they don't have any symptoms. But are there moments where you do have symptoms?
Sure.
And it's coming through your vision that will tell us that there's a problem?
Yeah, we've talked about this before. They could have no problems at all, as the case that I mentioned. Right. They can come in saying, you know, I'm seeing maybe some small little floaters, which there's a lot of varying degrees of diagnosis that can go with that. Okay. Spots in the vision, darkening to the vision, and just general, I'm not seeing as well as I used to. Distance isn't as sharp, and we go through a whole gamut of things that it can be and differentiate from what it can be. But more often than not, lately, the patient clientele that we have, the world that we live in, diabetes can be a very big culprit from what we're seeing.
Is it possible that you can be diabetic and you can control that and it won't affect your vision?
Yeah, absolutely. And even in that case, that patient we got in under care had no problems. They've recently started him on some medications, diet, health, exercise, things like that. And he's still only in an early phase to where he had no problems with his vision. I always tell patients, it can get worse. It can get to a point where you can lose your sight. It can also get better in those early stages, and that's something that we need to follow up for and watch. Okay,
and treatment plans are obviously extremely important. I want to show an image of an eye, and this is what you see, Dr. Myers. Now, we've got the normal eye on the left, the diabetic eye on the right. And it's amazing to me. It's those little tiny dots.
This is very microscopic, and this is the importance of a dilated eye exam. Most people are always fearful. We live in the Valley of the Sun. It's really terrible to get the eyes dilated and have to drive home, but this gives the doctor a much better view. The picture on the left, normal healthy eye, that white spot with the blood vessels is the optic nerve. The darker spot, maybe a little off to the left or the right of that, is the macula. But in the picture on the right, this is a healthy eye. This patient's seeing very well, but these are tiny changes that we can see with a very small lens, and we can start the treatment and prevent problems in the future.
Which, with that eye, that diabetic eye, chances are they're not experiencing any symptoms.
None at all, yeah.
See, that's what's so crazy. That's why it's important to get an eye exam.
Absolutely.
Okay, all right. Dr. Myers, thank you so much. Good information. We don't want to scare you, but you know what? It is critical to your eyesight. Find out where you can find a Nationwide Vision Center near you. Just call this number. They have tons of locations, 1-800-EYECARE, or learn more at nationwidevision.com.